We continue to applaud the hefty effort our local media makes to get to the facts as well as help keep our community informed. For that, I'm indebted. I have a couple of important public service announcements today. Some of them are in a slightly different place than the usual commentary. Today is officially Census Day during the self-response period. And the census, and I'll talk about it in just a second, is an extremely important function in our community to get done right. You can take the census online at 2020census, census.gov, or even over the phone if you don't have access to the web. That number would be 844-330-2020, and I hope our media folks will help me with that. You can do this from the comfort of your own home before folks start showing up in May. If you don't do it online or by phone, we're going to have to come get the information from you. This is the first time I think this is all being done electronically or telephonically, and it's the best way for everybody to do it and keep safe. The governor recently, I think, has been talking about the importance of our census, but as the chairman of the Peoria County Board, and on behalf of Mayor Artis and Chairman Krug from Woodford and Chairman Zimmerman from Tazewell County, I can tell you that's how our local communities receive a lot of important dollars, is from the statistical information that the census assimilates and accumulates, the funds that come back to our communities in the future that help with health care, social service needs, education, and there's a really, really long list, are tied to an accurate count. So if we underreport, if we don't go online and report what they're asking us to, or make the phone call, or we fail to answer the door when folks come around to follow up those homes that have not submitted their information, then we're going to fail for the next 10 years to receive the funds that we should receive as a result of an undercount in our community. And it's a particular time like we're going through right now that I think you can see why it really matters to be counted. So that's my first public service message. Yesterday, you'll recall, I think the governor went ahead and extended the shelter at home place to the end of April. I want to re-echo Mayor Artis's remarks from yesterday that it is really critical to stay at home. We've just gotten into, pushing back on the dimensions or acceleration of the curve of contagion. It's not the time to be complacent. For me to you, 6 foot ought to be 8 foot. We ought to really begin increasing the social distance from one another as a means of reinforcing to others how important it is not to assume anyone is negative. In fact, it's simpler to assume they're positive and behave correctly. We need everyone in our area to heed these warnings. Staying home when you're sick, washing your hands constantly throughout the day. Don't touch your nose, face, eyes, mouth. Cover your coughs, cover your sneezes, and immediately wash your hands. And it seems like we keep saying these things, but now is the time to really push hard for the next 30 days to deflect the spread of this contagion. And because spring is upon us and the daffodils are popping up and the sun is out and the weather's mild, it seems like everybody wants to go outside and do something. And while that's permitted, congregating in playgrounds is not, a pickup game, basketball is not, and unfortunately, Sunday church in the parking lot at your favorite congregation is not either. There's really very little way for church congregants or other faiths to assemble and not just add to the problem no matter how much social distancing they practice. By nature, church goings, faith-based goings are congregations of people, and we do not need to endorse, nor is it really permissible to do so. Dr. Stoner will be up next. The health department vigorously recommends against doing that. Of course, our area continues to be blessed. I work with us every morning on calls to have extraordinary healthcare systems who continue to prepare educate, train, and inform first responders, community clinics, physician practices, nursing care functions within their health systems to prepare for an increased number of beds and super sick patients. It's our job as community leaders to help you understand the importance of this sheltering in place, and let's prevent the tidal wave from overwhelming all of us, because in spite of our very best efforts, that could happen if we don't beat back the rate that contagion is to spread. And once again, we all know people in the community that need additional assistance. Dialing 211 or calling 309-999-4029, we can get you some help. And since our organization runs 211, I can tell you those calls have doubled to over 100 a day, and we're happy to keep taking them. So my good friend, Chairman, Medical Director for Heartland Community Health Clinic, and today's cover for Monica Hendrickson, as he's also the Medical Director here at the Peoria City County Health Department. Dr. Greg Stoner will cover for Ms. Monica Hendrickson today.
Thank you. Thank you, Andrew. I couldn't agree more with Andrew's remarks as far as all the advice that we've heard over and over again, and I know people are sometimes getting tired of hearing that about washing your hands and keeping your distance, but again, this is no time to relax that and to become complacent. So again, encourage that, and also, as we've discussed in the past, it's also a time, if you have chronic medical illnesses, to really optimize your care and get yourself as healthy as you can, even in the next 2 weeks. Changes that you make might be changes that save your life should you get COVID-19. So today, here are the counts. Tri-County confirmed COVID-19 cases for April 1st. There are 8 in Peoria. That means there's 1 new case, and it is a contact of a previously positive case. Tazewell has 4, Woodford 5. Those numbers are the same. The hospital data reported from OSF St. Francis Medical and Unity Point Health Methodist, Pekin, and Proctor. There are 10 persons under investigation in the ICU, 1 confirmed COVID in the ICU, patients either diagnosed as positive COVID or persons under investigation are 6, and the total number of specimens collected for private or public labs, 14. So with that, I'd like to introduce Mark Roberts, who is the CEO of the Community Foundation of Central Illinois.
Thank you, Dr. Stoner. Good afternoon. I appreciate this opportunity to communicate to the greater Central Illinois area that the Community Foundation of Central Illinois has reactivated the Central Illinois Disaster Recovery Fund. The fund was first created in 2013 in response to the tornadoes of that November. Its purpose is to accept tax-deductible contributions that will be used to provide grant support to community organizations that are directly supporting our local residents and families, those who are most affected by emerging health, economic, and social impacts. Also similar to the tornado recovery, we are working to determine how we at the Community Foundation can leverage the donations we receive with other community organizations to make the best impact. We think it's important that we direct community charitable resources in a collaborative and targeted manner to ensure that we don't duplicate efforts, and that we direct those resources where they are needed most, and that we do that as a community as nimbly as we can. I think it's also important to keep in mind that as this situation continues to evolve, unmet needs and funding gaps are likely to emerge, as they did with tornado recovery, which points out the need to have a robust source of flexible charitable funding available for the broader community. So as such, we are encouraging all community members, including individuals, corporations, private foundations, all others, frankly, to donate to the Central Illinois Disaster Recovery Fund in support of local COVID-19 relief efforts. Donations can be made as follows. Credit card donations can be made online through the Community Foundation website at communityfoundationci.org. Checks can be mailed to the Community Foundation office at 3625 North Sheridan Road in Peoria, 61604. please include Disaster Recovery Fund in the memo of that check, or you can even text CFCI, that's CFCI, to 50155. That's CFCI to 50155. A important part of the mission statement of the Community Foundation says connecting people who care with causes that matter. And in my career, this is the number one cause that's mattered that I've encountered in this community. And so that's why we're inviting all those people out there who do indeed care to support the Disaster Recovery Fund. It's only by all of us working together that we're going to be able to make the impact on our friends and neighbors at this trying time. Thank you very much.
Guess I'll now entertain any questions.
Dr. Stoner, I know Monica Hendrickson explained this yesterday, but if you could, just for the listening public, because I think, obviously different people tune in every day. The IDPH website lists 10 cases in Peoria. If you could explain why that number might be different from what is actually confirmed here.
Sure. Again, the Peoria as a healthcare system draws in patients from a very large area into our community because of the two large hospital systems here. And so people can be registered here as a patient on one data set, but their county of residence may be a different county. It's kind of a confusing thing, and I probably don't even understand it completely, but it's one of those things that the patient can reside someplace else, get their care here, and show up in both data sets, apparently. So,
as of April 1st, have any COVID-19 patients in the Tri-County area recovered?
I don't know that, whether they have or not. I would think because the number of people in ICU, I think, has gone down just a little bit. I would think some have recovered. There's been no deaths yet, so.
Okay. I think on Monday there were 3 in ICU, yesterday 2, and today 1. So are
Yes.
those people from Monday who are no longer in the ICU, or have they recovered sufficiently to be discharged from the hospital, or at least from the ICU?
I don't know if they've been discharged from the hospital, but it would seem that they have been discharged from ICU. So they still may be in the hospital, and they'll be kept there probably until they're stable enough to go home. Okay.
Dr. Stoner, we've talked a lot about, how obviously this is dangerous for people that have pre-existing conditions. Can you talk about the potential effect that COVID-19 could have on just, say, longtime smokers?
Sure. There's a lot of kind of thoughts about smoking and what it does, okay? And so there are short-term effects in that it affects your lungs kind of instantly and kind of causes damage to the little cilia that wash up mucus and keep your lungs clear. And then over time, it causes damage to the all the lung tissue in there, so it just doesn't function as well. You can't get oxygen in as well, and you can't get carbon dioxide out as well. And so people get more and more shorter breath over time. And then there's always the risk of lung cancer with smoking too. So cancer is a risk that not everybody gets that smokes, but emphysema, chronic obstructive pulmonary disease, everybody gets that who smokes. So they're all at risk for having worsened symptoms with the COVID-19 on top of that.
So staying on the topic of smokers, is it sorry you already mentioned this, but is that different from those who smoke cigarettes or those who smoke marijuana, different effects?
Apparently the smoke from marijuana is still not good for your lungs, okay? It still does damage similar to regular cigarettes from everything I've been able to discover about it. Okay. Vaping is a totally different thing in that it has a whole new set of complications. And so there is a new lung disease called EVAPI that happens from vaping that's related to some of the chemicals that are in there along with the nicotine. The nicotine is what addicts you in cigarettes, and it's the tars that actually do the damage. But in vaping, it's the nicotine that stays that satisfies that addiction, and it's the other chemicals that they put in there that help either make it taste better or not be quite as irritating to the lungs that actually cause severe reactions in the lungs in a fair number of people.
So anybody who smokes anything is at greater risk for getting more severe COVID-19 symptoms?
Absolutely. Yes.
Federal experts are projecting 140,000 to 200,000 deaths in the United States because of this, and possibly over 1 million cases. Do we have projections for the local area on those numbers, and if so, what are they?
Okay, there are projections that have been done for this area. I don't have them with me, and they are they're distributed by age and what are expected, and so they're not very cheery numbers when you look at those. And so I don't want to give you an exact number for an age group. I looked at my age group and it scared me, and so it is something that is important, and it brings home why we're taking all these measures. When you see the modeling that's been done and the ranges of people that will be in ICU and people that will not survive the event, it is very sobering when you see those numbers. So I'm sorry I can't give you the exact numbers now, but we'll.
Are they available online? Are they made available at all?
I don't know. These are from like a national source.
Oh, local, but they're local numbers.
But they've broken it down by region. And so we have a regional number that looks at our tri-county area.
Okay.
Okay.
So can we get those tomorrow possibly, if they're not available online?
I
see two sources, University of Washington.
Okay.
Okay, they modeled cases from Washington. The second I'd seen was Rush.
Okay.
Some of our
We'll do our best for you. Okay. Okay. Thanks.
Some of our viewers want to know how long the virus can last on objects like door handles, bags.
Great question. There was a big graph of that, and it varies according to the surface. You know, the type of surface, whether it's paper, plastic, copper, with cardboard, stainless steel, and the kind of range was up to about 72 hours. Was kind of what most of them were at. Copper was actually really short. It was like 4 hours on copper line surface. Go
Do
ahead.
you know the longest amount of time? Is 72 hours like the longest amount of time that it can last on an object?
I'm not positive. That's what I saw. Okay.
And then also, allergy season is upon us.
Uh-huh.
Sneezing, coughing,
Mhm.
itchy eyes. Do you think that could increase transmission, by mistake? Just the fact that people are sneezing, droplets are falling, you're touching your eyes and you don't even realize it because they itch.
Certainly, you'd have to have the virus to be transmitting it. So someone with the virus who has allergies is going to probably transmit it more if with their allergies, because they'll be sneezing more and doing all that. But they have to have the virus to begin with. Okay.
Any other special recommendations you have for those with allergies?
If you're on allergic medicine, antihistamines, particularly the non-sedating antihistamines, I would take those regularly. That'll minimize the amount of sneezing and drainage from your nose and all that stuff that happens. So absolutely, I would go on one of the non-sedating antihistamines.
Dr.
Okay.
Stoner, not sure if you're privy to this information, but as Tim was talking about, seeing the number of cases that are in our ICUs decreasing, do we know if that's just because the people are naturally getting better, or is the hospital giving them something specific that's seeming to help?
As far as I know, they're not using any of the experimental drugs right now here. So that would be their body adapting to it and getting through that with the kind of support that they need with the oxygen or the ventilator or whatever other support, the IVs, all the things that would be done to support their health through the ICU admission.
Do you know how many ventilators are in use in the ICU right now?
I don't have that number. Okay.
Do we have an adequate supply though, as of right now?
As of right now, we certainly do.
And then I know this has been discussed nationally, but if you could, for our local viewers, discuss how, one ventilator doesn't necessarily equal one person, how one ventilator can be shared.
I think there have been attempts to share ventilators between 2 and even 4 people, but I don't know that they've been all that successful yet, and I don't think they're planning on sharing ventilators here right now at all.
I have
Okay.
a question for
Okay.
So you were obviously talking about, today is Census Day. It's almost hard to believe. It doesn't feel like it with everything going on. Do you have any idea about the percentages in terms of locally of what we're at right now, the number of people that have completed and how that's different from other years where, you've been able to do door-to-doors and things of that nature?
I want to give you a couple of resources on that. City Councilman Sid Ruckriegel and County Board Member Rob Bruneau are two local experts, and I'll give you their phone numbers after I leave.
And then, are there any other plans in terms of maybe I'll have to ask this to the same people, in terms of maybe phone calling campaigns, things to still try to get people to complete the census?
Again, I'll defer to those two because they do have campaigns presently underway, and so does PCEO, I believe. They're separate but similar in nature, but I'll give you their numbers because they're working on it every day.
This might have been touched on slightly yesterday, but we see in big cities, just places getting turned into makeshift hospitals should the capacity get met in hospitals. In Peoria, what kind of plans do we have in place for it if that needs to happen?
That's a great question, and both systems have those plans in place, and both systems have already deployed triage areas in front. I don't know if it's necessarily in front of their ER, but outside of their building in preparation for large triaging, meaning prioritizing, sorting out, to make sure that they can control patients that need to go inside and those that could be sent somewhere else. So that is already underway. In terms of some of those full-scale field hospitals, the Illinois Emergency Management Agency and the Illinois National Guard generally are involved in the construction of those larger operations that you might see, as well as some folks from FEMA, but there are none presently in town.
I have a question for Mr. So, as you talked about, the last time this was kind of deployed around the time of the Washington tornado, hard to think of this, in that kind of a realm, but because it's, an invisible enemy. Talk about kind of your call to people, as a lot of people are struggling with their own financials, maybe small businesses that, can't work right now, maybe people that have those funds, kind of imploring them to do what they can to help others.
So the question has to do with is there a role for everyone, particularly those who may have less means? A community foundation by design is the foundation for everyone in the community. And there is, and particularly with a fund like the Disaster Recovery Fund, there's literally a role for everyone to play. Some people can write bigger checks, that's within their capacity, but a contribution of $1 or $5 to the fund, when aggregated with the donations of hundreds and thousands of others, makes a tremendous difference. So literally, every dollar matters, and it's never mattered more than it matters right now. So that's why we encourage everyone to take part if they can.
And do we start with a baseline, like, do we have a reserve fund that we start with and we grow from that, or are we literally starting at zero?
Actually, the board of directors about a week ago committed $25,000 of community foundation funds to help seed the fund and to get it going. And we certainly challenge other organizations and would invite other organizations to match that and to help this fund to grow. We're developing some plans to do some incremental fundraising and campaigning around this to make it visible and make sure everyone in the community, the broader Central Illinois community, frankly, know that this is very important.
Just having dealt before with a large-scale disaster like the Washington tornado, is there anything from that experience that's transferable to helping now?
I think everything in regards to the process. I think you've both indicated with your questions that every disaster is different, and that's absolutely true. But the process in regards to engaging community members, engaging community organizations, and making sure that we all align as best we can in the community. If we're going to have a pot of charitable resources or multiple pots of charitable resources, that we apply them in a way that's systematic and that makes good sense and really targets all of that money to the people, to the organizations that need it most, that in turn can help the people who need that help the most as well. So very similar in approach, though certainly different in the substance of what we're dealing with.
Was there any money left over from the Washington tornado that's transferable to this, or is this just starting as Caitlin said, from like the ground up with the exception of 25,000?
Yeah, there was a small amount of money remaining in the fund. I think it was in round numbers, about $15,000. The intent of that fund wasn't solely to respond to tornadoes. The fund is really intended to respond to all disasters that may happen. So the fact that we had a very minor amount of money remaining certainly allowed us to go ahead and start to think about how we deploy that right away. But it's clear, we need a lot more contributions to come in, so we're going to be able to collectively make the impact that we need to make. Anything else? Dr. Stoner, thank you.
If there's no more questions, we can end today's press briefing. Thank you all.